Good afternoon, everybody.
Good afternoon.
Thank you so much for being here today. Today is Wednesday, January the 29th, 2025, and it is approximately 5:38 p.m. I will now go ahead and call the meeting to order for the Suicide Prevention Committee. And we will start with a roll call.
Dr. Julie Bazan,
Present.
Maxine Verdeles,
Present.
Edwin Martinez,
Present.
Miguel Rangel,
Present.
Maristela Jacqueline,
Present.
Earl Medina,
Present.
Gabriel Martinez,
Present.
Jaime Montes,
Present.
Marina Medina.
Present.
And I want to just say thank you to everybody for being here, to all the members. We have 100% participation from all the districts, so that's wonderful news, and that's I know we also have some representation from the different agencies in the community, and we'll get to that in just 1 second. So the next item on the agenda is a reflection, and this is something we've been doing since we started meeting as a committee. So if you will allow me a moment of reflection, I would appreciate it. Heavenly Father and everlasting God, thank you, Lord, because you bring us together as your family to do the right thing in everything we do. We thank and we say. We invite you to join us tonight as we gather to plan for the benefit of our community, the people that need us, the people that you put in our paths so that we can sustain their needs and guide them to the right direction. Join us as we gather here and guide us throughout the night, take care of our families, our co-workers, our community, our world, God. We put it all in your hands. In your name I pray, Jesus Christ, amen. Thank you. For public comments, citizens are required to notify members of their intent to comment prior to the start of the meeting. Comments are limited to 3 minutes per speaker. No more than 3 persons will be allowed to speak on any side of an issue. Should there be more than 3 people who wish to speak on a particular issue, they need to select not more than 3 representatives to speak for them, and the presiding officer may limit the public comments further in the interest of the orderly meeting. Speakers may not pass their minutes to any other speaker. Comments should be relevant to city business and delivered in a professional manner. No derogatory remarks will be permitted. Do we have any public comments?
No public comments.
Thank you so much. The next item is the approval of the minutes for November the 20th of 2024. If you all recall, we did not have a meeting in December for 2 reasons. Some people were under the weather, and then it was very close to the holidays, so people were traveling and enjoying their family. The minutes are in your package. So I'll give you a minute to read them if you need to. I think the highlights of that meeting were number 1, that we selected the Suicide Prevention Committee logo, and also we talked about correspondence to the legislature regarding the mental health hospital needs. And we received an update on different projects in the community. And we also spoke about activities to be held during the holidays to create awareness about the 9/8. And those were the highlights.
I'd like to make a motion to approve the minutes.
Okay, we have a motion. Is there a second? Okay. So we have a motion and a second, and remember, just a reminder, which I should have done in the beginning of the meeting, only the appointed committee members can vote on items. Is there any question or comment before we take a vote? Okay, all those in favor say aye.
Aye.
Opposed, same sign. The motion carries. Thank you so much. Now the committee membership update. As I mentioned earlier, we have 100% participation, and I'm very happy to hear that. I know that there were some members whose term had expired because of the fiscal year, but those terms are automatically renewed unless the city councilman or the member himself or herself decide that they no longer want to be part of the committee. But at this point in time, we do have interest from all the committee members. And all the district councilmen and women have selected their representatives. So no changes to the committee membership. Any questions on that? Very good. The next item is a report to the City of Laredo leadership. And this is a report that was submitted on January the 2nd, and it is part of your package for the committee members. And this was a report on activities that we held between July and December of 2024. And it's a complete report. We attached information, minutes of the different meetings we held, pictures of some of the activities, statistics. So this went into the city leadership, and I wanted y'all to have a copy so that you can see some of the things that we were able to take part in. And based on what we have done, we also need to look and see where we want to go in the future, okay? So I just wanted to make an announcement about that, and of course you can have a copy of that and take it and read it. Or if you would like an electronic one, I know Ms. Angie can make that available to you. And that also applies to the members of the committee of the different agencies. And I think that this is why it's important for everybody to sign in and put their correct email address, so that whenever we have information like this, all of you can receive it electronically. Questions on that report to the city leadership? Very good. Let's move on to the next item, which is the City of Laredo Police Report. Chief?
Good evening, Assistant Chief Ricardo Gonzalez. This evening, I'm going to be introducing a new member to the group, Sergeant Heriberto Avalos, who would be replacing Lieutenant Robert Garcia. Lieutenant Garcia is going to move on to another assignment. So hopefully for an extended period of time. Right now it's momentarily, but he's very passionate about this topic and the things that we deal with. So he's going to be joining the group, and he'll be presenting tonight. Sergeant?
Thank you, Chief. Thank you for the confidence. Greetings, my name is Sergeant Heriberto Avalos Jr. I see some familiar faces here. I've been in the department for 22 years already. I've been an officer, patrol officer for 15 years. I was a detective for 5 years at the Crimes Against Property, Financial Crimes. I've been a supervisor for 2 years already. Supervised records department, IT department, and currently I am the supervisor for the Crimes Against Property and the Mental Health Unit. I welcome the challenge. This is a new field for me, but this is something that's very important. I myself had lost people to suicide, family members, so when the chief said, hey, Eddie, you want to take this challenge? I said, of course, Chief, I will welcome the challenge. So, without further ado, thank you, and thank you for accepting me here.
Welcome.
As you can see below is the statistics for January 1st through January 29th. Attempted suicide calls, we've had 14 for this month. Attempted suicide reports, we have 18. Suicides resulting in death, we have 4. Emergency detention, we have 44, and emergency detention calls, we've had 39. And this is a breakdown on the calls that we've had this month. As you can see, January 11th, we had a 21-year-old male, gunshot wound, deceased. January 12th, we had another one, stabbing, laceration, 47-year-old male. January 13th, attempted suicide, gunshot wound. January 14th, deceased, 49-year-old male, gunshot wound. January 27th, attempted suicide, gunshot wound. And this morning, believe it or not, we had a gunshot wound, deceased, 75-year-old male. This is one of the first ones that we received this year, the suicide. It was at the 4000 block of Aguascalientes. It was a gunshot wound that happened Saturday, January 11th, 2025, approximately 1:28 a.m. Police responded to the said location where they encountered a 21-year-old male that was unresponsive with a gunshot wound. He didn't have any prior history as being a patient at the Border Region Behavioral Center. The next one we received was at 3400 Mier Street, which happened on January 12th, and it was a stabbing. That call came in on Saturday, January 11th, 2025 at 12:54 p.m. Police responded to said location where they encountered a 47-year-old male who was unresponsive with an apparent laceration to the throat. This gentleman did have prior history of schizoaffective disorder, bipolar disorder, and he was a cocaine user. The next one that we received was on January 24th, 1800 Barrio Street. On Saturday, January 14th, 2025, approximately 1:26 a.m., police responded to said location where they encountered a 49-year-old male who was unresponsive with apparent gunshot wound. This gentleman didn't have any history as being a patient at Border Region. And the one that we received today in the morning, it was a 75-year-old male that was unresponsive to apparent gunshot wound to the head. When officers arrived, he was already deceased. He didn't have any history of being a patient, but he pretty much did state to the family members that he had an extensive medical history, he had cancer, and he pretty much didn't want to be a burden to the family. And that is my mental health evaluation outreach unit. I am Sergeant Heriberto Avalos, and please feel free to get my number, and this is my staff. Officer Jacqueline Davalos, Officer Emerson Barbosa, and Officer Gilberto Ramirez. And I apologize, but I didn't add my email address, but I will include it in the next presentation, guys. If you all have any questions, anything that we can help you with, please feel free to call me or any of my staff.
Thank you, Sergeant. Before we move to the questions, if I can just ask everybody for a moment of silence, since we lost those lives to suicide. Thank you, everyone. You know, it's never easy to hear the report.
I almost fell.
I'm sorry.
Hello, Jaime, how are you? Thank you for joining us. It's never easy to hear those reports, but in a way, it's a reminder as to why we are here and why we need to continue to stay committed to the mission of this committee, and why is it important that we continue to be proactive in every way possible. So thank you for providing us with that report. Now I'd like to go ahead and ask anyone if you have any questions about the report that we just received.
Dr. Basan, I would like to make a comment. In this case, I learned from the supervisor at the scene that this gentleman that died by suicide this morning, obviously there are other members in the household at the time that this happened. And from my understanding, the 10-year-old granddaughter was, after hearing the loud noise from the gun going off, went into the room and was one of the first ones that saw her deceased grandfather, now obviously very impacted by the event or by the scene. We've been working with LISD on a Handle with Care program where we learn of an incident that happened outside the school that might affect the child, especially in the performance or behavior.
Right.
We let them know so that they can obviously be considerate of the situation the child's going through and work with them. Obviously, it's going to affect studies, behavior, you name it.
Everything.
So this child, from the case this morning, belongs to UISD, so I don't know if we have anybody from UISD. Is there any way we can refer the name to the
Yes.
counselor or?
Let me know who it is and I will send it to Mel.
Okay.
Ramirez.
She said she was gonna try to make it tonight, but we'll make sure she get that information.
Yeah, because when we have situations like that, right, we reach out to her and she right away says who is it, so we can provide the necessary immediate counseling that they need. But that's traumatic, that's gonna
Yes,
be
very
wrong.
much. And you know what, are you still distributing that little card, the business card that we created? Because we need to add on there UISD and LISD counseling department.
Mhm.
So that way the parents have that also, if it involves a child in either district, right? So we will revise that. Is there anything else that you think we should consider?
No, I think that's
What
good.
other family members were there? Because I mean, they'll be impacted as well.
I'm not really sure, in my brief conversation with the supervisor, that's, obviously, that was the main concern.
Yeah.
That I guess they saw, and they reached out to our victims' rights coordinator, and obviously he told them, no, this program's only for LISD children, so that's when we met that wall, right? So, and we don't want to be disclosing the information to anybody, so we just want a good protocol process so we can be able to share that information, gets addressed immediately and effectively.
So we'll go ahead and add that, and also the private schools, we'll reach out to the private school system, so this way everything is in one site. And I know that Becky from our AHIC team will make a note of that, so we make sure we do it. Any other comments or questions?
Dr. Bassani, if I may, and honorable board, if there's any information or any additional information that would make this report helpful, please let me know. I welcome constructive criticism, guys, so let me know. And if there's anything I can add, just let me know.
I'm glad you mentioned that, because one of the things that I was asked when I was at one of the veterans meetings is, how many veterans in the statistics? So I don't know if there's a way that you could find that out.
I can try and find out. I pretty much have information with one of the veterans employees there, and so I'll ask. I can reach out and start asking for that information. I know that I think Lieutenant Garcia only provided just the ones that actually are deceased, but I know we do have attempted suicides that are pretty much, they're on there, and I know because Ms. Jackman asked me about one that happened yesterday, but the individual did live, it did survive, and if you want information on that, let me know, and I can include those as well, Dr. Wilson.
I would love that, because this way we can make sure that I follow up with the VA system and let them know that there's more need in our area, that we should not overlook that for our veterans.
And Dr. Basan, I also, especially on those attempted suicides that survive, I think there needs to be some sort of, maybe we come up with a protocol on how we can do follow up with them, because they're going to be especially in need of help of some sort. And one other comment, and I don't know how it would be, how we can, I guess, incorporate these concerns, but from what we know, when individuals are suicidal, they can also be homicidal. And like the murder-suicide that we had.
The capital murder, yes, that's right.
Well, the one that just happened with the man and the
Okay.
40-year-old and the 20-year-old female. I think that when the hotline, when we contact people or people contact us, we are definitely very concerned about the individual who is suicidal, but we also need to address how loved ones, family members approach, because many times, again, as psychologists tell us, if they're suicidal, they are one hair away from being homicidal, and that's when they hurt the mother or a loved one. And it's not anything that they can actually control. It is something where they're in a certain place.
No.
So that's something, an awareness that somehow we need to somehow incorporate that. Because when I started prosecuting cases and we learned And the one example that we had was the Samuel Lopez case. We had an issue where he had mental health issues, and he didn't kill himself, but he killed his girlfriend and all of the family. And so those are things that if people are aware of that, they're mindful of it, and somehow the approach, that's why you think you're dealing with let's say your spouse that's going through some crisis, but that's not what he's seeing. And that's why you need somebody who knows to help and maybe get involved as well. And so that way people feel more, they'll be more receptive to calling in and telling us about it.
And more prepared as to where they can reach out for help
Yes.
and what they can expect or the signs, et cetera. And I think you bring up a very important point, and I'm going to put this down, follow up on those that have attempted and did not succeed, right? And then the suicidal, that can turn to homicidal. Maybe we can develop a plan of action like you said. So I wanted to bring that back to the table under the discussion to see what we can do, because that's very important. I think that's something we had not talked about before. Gabriel, Maxine, Earl, Marina, this is something that's new that has been brought to the table, so let's revisit on that. Any other comments or questions for Sergeant Avalos? Okay. Then let's move on to the next item on the agenda, which is an update on current projects. And the first one to report is the Laredo Public Health. And we have Dr. Montes with us representing Dr. Chamberlain. Dr. Montes.
Yes. Good afternoon, committee. I'm the community health administrator here at the Laredo Public Health Department. I have 4 months on the job, and I'm committed to go ahead and improve anything that relates to suicide and anything related to community health. I want to go ahead and present the team, if you guys already know them, and just to do a recap of the individuals here that are on the front lines and helping us support our mission and our vision.
Elena Morales, Harm Reduction Specialist. Erica Lopez, Program Manager for the AOT program, and I'm a Case Manager and an Office Assistant as well.
Hello everyone, Christina Duarte, Health Education and Promotion Manager here at Laredo.
Hello everyone, Carmen Andrade with the Children Youth with Special Healthcare Needs Program. Barbara Escamilla, and I'm the Supervisor for the Community Mental Health Program.
Welcome, thank you.
Thank you. So our topic today is that we're researching. The topic is from research to reality, and we're keeping an eye on suicide prevention technologies. My background is in technology and business management, and I bring that discipline over to public health and to see how we can maximize data collection and be proactive when we tackle this public health concern. All right, so first of all, I wanted to mention that we are exploring solutions for awareness of digital screening solutions, of which we are looking into computerized adaptive testing. We're exploring how we can integrate it into our healthcare system, and there are some legal and ethical and perhaps even legislative issues that we need to look into. But we're keeping an eye. We want to report to the committee that it's something that's in our radar, and we're going to keep an eye on that. We're looking at automated mental health screenings integrated into primary care settings, schools, and community centers, such as they've been deployed in other cities, such as Chicago, which is the organization under the name Energy. We're exploring predictive analytics from digital assessments, which may help provide tailored interventions. The Laredo Public Health is also monitoring these developments to assess their applicability to our community. We're exploring mobile health apps like Crisis Text Line, My Strength, Safety Net, and Mood Tools, which provide mental health resources and crisis intervention. There was a study that I was reading yesterday that was testing out the effectiveness of the apps, and forgive me, I'm not too strong on the clinical side. That's where we have our staff members here that can help us out on that aspect, but it's just gauging the effectiveness. And I believe there was 1 out of 6 clinical, you're welcome to chime in, our professionals, but 1 out of 6 clinical approaches that there are to address mental health behavior. And so far, the success rate, our preliminary investigation as of yesterday has been like 1 out of 46. So there's some work to be done on the mobile applications, but we will keep the committee posted. And users track, yes. So we're also looking at studies that suggest these tools can help users track moods, access coping strategies, and connect with emergency services. With me on board now, I'll coordinate with PD and other organizations to see how we can implement data and enhance our proactive approach. And from here, we're going to look at also some AI-driven tools to go ahead and analyze electronic health records. We can start by our clinic and go ahead and migrate and be a voice for private practices and hospital systems to incorporate these technologies into their systems, which they can analyze mental health behaviors, clinical assessments, and be able to make these deductions of follow-ups, etc. Machine learning algorithms, it's a little bit technical. We're looking into for them to be automated flagging systems. And of course, just reiterating the monitoring studies on impact AI-driven suicide risk screening for potential future consideration of it. And we understand that social media plays an important role in identifying individuals that be undergoing, mental health crises. Excuse me, this is my first time presenting. So some AI tools analyzing social media content to identify individuals expressing suicidal ideation. Some platforms have started real-time intervention responses connecting individuals to crisis resources. So we're tapping into Meta, into other social resources that might be able to give us that first-hand data, so we can go ahead and relay that to the authorities, etc. And from there, we are also exploring the monitoring of wearables. We're seeing how smartwatches and biometric rings can go ahead and monitor stress levels and emotional distress, and see how we can tap into that data, and maybe at the clinical side or maybe voluntary enrollment, and we can go ahead and explore these solutions. And the next step, we are not implementing of these, or we're not yet championing or getting behind these tech still, right? Because we do have those ethical and legal considerations to take in mind. But we just, as I mentioned, we want to keep on the forefront. If you guys have any suggestions or come across any tools, feel free to share it with us or the team, so we can go ahead and streamline these processes and be able to be proactive in our approach to this public health concern. Right. And that is it for me. If you have any questions that relates to this, we can go ahead and contact our department. We are at your service, and anything you need, and we'll be able to help you guys out.
Thank you, Dr. Montes.
Thank you.
Anyone needing clarification or have a question on his presentation?
Go ahead.
Dr. Montes, Secretary Moreno from National Border Patrol Council.
Sir.
You mentioned some apps earlier in your presentation.
Yes,
Are
sir.
those free and downloadable, both app on Android, or are they just specific to a program that you can download from?
Yes, sir. So right now they're on both platforms. On some of them I did see that they were research based, they were grant funded. So we're able to go ahead and look at it. Like I said, I mentioned, just yesterday at night, actually at 2 in the morning, I was researching and I saw that study that said 1 of 46 that was effective. But right now, both of them they should be on both platforms, OS and Android.
Weren't you using an app?
Yes, within the Border Patrol, Department of Homeland Security, they've downloaded the Columbia app
Okay.
on all government smart devices. I want to see what's out there so I can give more tools to our workforce. And
Okay.
obviously, the public apps, I want to be shared with the families. So I'm trying to do that research on my side, but I was not aware there were many others. But I can loop around after this meeting so I can.
Yes, sir, definitely. Yes, because we do want to, keep at the forefront of checking the effectiveness, and of course, on our clinical partners, and see that they're agreeing and are in synchrony with what we deploy.
And I know I'm not referencing a specific app. I know that we've looked into different apps because we would like to get all of our clients connected to them. The issue is they're not always free. because you
Yes.
have real people operating them, and which is better than an automated response.
Yes.
So it's just about doing research and finding the right option
Right,
for
yes.
us, or what your organization has
Yes.
the capacity for.
There's some grants, and there's availability that we're exploring to see if we can, there are linkages to services, et cetera. But we'll keep you in the committee, we'll report.
Well, thank you so much. I'm a one-man team, so I want to get as much
Of course.
And I think this is a perfect platform to share what we
Yes.
have discovered, even from your entity, yours, anyone around the table. This is where we need to come and share so that we don't have to reinvent the wheel.
Exactly.
And we can save each other's time and commitment.
Perfect.
Dr. Masan, the gentleman behind you.
In reference to the apps, the college just made a commitment to providing an app service to all students. And like it's been already been mentioned, behind the app is a living person that the student specifically chooses who they want to meet with. And so it provides the first level of counseling. And then if that escalates to higher levels of treatment, then there are psychiatrists behind the scenes as well that are part of the app family. And so all that is a service that's being provided free of charge to our students.
What app did you?
We're launching it just next month, actually.
It's a proprietary app for college personnel?
We did not, it's a commercially available app, but the app comes with the service behind it.
Understood.
Yeah.
Understood.
And so the app is really the portal to access this laundry list of counselors
Awesome.
and psychiatrists and professionals that are available. And the
Thank you.
student picks and chooses who they want to meet, if they want to have the session in Spanish, et cetera.
Very much needed.
What I do want to mention is that as a committee, if we can all come in consensus to one app, right? So we can centralize this data.
Absolutely.
One thing from an angle, from a tech perspective, is that I see the data siloed
Right.
with different solutions.
Right.
So when we do that, it's hard to analyze and be able to run algorithms and do forecasting.
Right.
So in order to increase our effectiveness and proactiveness, the centralization of the resource is vital.
We had to move in that direction because of the lack of the human resource available to students. Counselors are very difficult to come by. And so as an alternative to augment our service, we went to the app service.
And I'm wondering if Tammy, you have something like that, so I'm gonna reach out to them and see, so that we can begin to collect along with the app that y'all are using,
Yes.
and anybody else. Please bring the information to the table so that we can work more effectively. Right, Doctor?
Yes.
And Dr. Montes, you want to reach out to Integral Care of Texas? They even have a risk widget on their electronic health record system. And on that system that they have, they just had a presentation for us, and they can do it for you all as well. The last CSSRS, they got the missed appointments as far as when they have to have the follow-ups, safety plan, PHQs, all the kind of thing that's important to track anybody that's at risk. Okay, so they've been having success with this. They don't have the same electronic health record system we have at Board of Region, but we were all taken aback, even the state folks, that they have this in place. So Integral Care of Texas, Central Texas, okay.
Thank you for that.
Thank you, Frank. If you can send me that information, I would appreciate it. Any other comments or questions on this item? Very good discussion.
Very, thank you.
Okay, now we move on to the You Are Not Alone awareness. And this is something that's really important. I know that in early January, if I'm not mistaken, Melissa from UISD sent us, Dr. Chamberlain and I, an email about the shortage in funding for the 988. I think you might have been aware of it, Frank, that there was not enough money to continue running this. I mean, it is available, but with limited operators, if you will. And so she sent us it was in the Texas article, which I will pass around or email to all of you. And she brought it to our attention, and immediately, of course, Dr. Chamberlain drafted a letter, and then I also sent it, so separately. I sent it as the chair of the coalition or the committee, and he sent it as the chair of the public health. And it states that we are asking and soliciting the support of Senator Saffarini and the legislators, since they're in session, to support this bill that was being authored by another senator to increase the funding for this, because as all of you know, Laredo's underserved, Webb County's underserved in the entire South Texas, and if I may say, probably the entire state of Texas, not enough mental health providers. So what are we relying on as residents of this underserved county is the 988. It's the easiest resource to have 24 hours a day, and that's what we have been promoting. So it looks very good, so hopefully we will have some good news about additional funding. So this is, why am I saying this? This is an example of how this committee comes together and creates awareness immediately. If somebody brings something to our attention, then I know Dr. Chamberlain and his entire team is very effective in reacting in a positive manner, and then bringing me into the picture so that I can also send that correspondence out. So I wanted to bring this to your attention so that we can be on the lookout, and as we get updates on this, I will share that with you, and I will send this electronically to all of you as well. Okay, so on the 988 awareness, we did a lot of activities before the holidays, before Christmas, before New Year's, and after, and I think they were effective. And I'm sorry to see the numbers for January, but I try to look at the statistics in this way. How many people received the message that 988 is available? Because what if we had not delivered that message? Would that 4 be 10 or 20? I don't know. We'll never know, right? The idea is to make a difference in someone's life. You will never know when you will say the right thing to someone, that they'll walk away from you and they'll go back behind closed doors and call, or get in their car and call the 988. So I want us to stay focused on that. But the message and the activities is not done by one person. It's done by the entire community agencies. And for that reason, I'm going to take a minute just to have everybody introduce yourselves, the name and the agency that you represent, so that we can tell the community that's watching this, tell the leadership of Laredo and our legislators that it's not just one agency or one person, but it's multiple agencies. So your name, I know that you're one of the committee members, the agency that you work for, and then we'll go on. Yes.
Jaime Montes, and I represent District 7 for Councilwoman Vanessa Perez.
Thank you.
Hi, my name is Cynthia Diaz. I'm the Director of Student Health Services and Wellness at the Laredo College.
Hi, I'm Nelly Sosa. I'm a counselor at Laredo College.
Maxine Reveles, I represent Roberto Zayas, District 1.
Gabriel Martinez, representing District 6 by Dr. Tyler King, and I also work at Gateway Community Health Center.
Mackin Montes, Community Health Administrator, Laredo Health.
I'm Becky Diaz. I work at Area Health Education Center. I'm the Special Projects Coordinator.
I'm Earl Medina, Vice Chair for SBC. I also represent District 5 for Councilman Ruben Gutierrez, and President and Founder for We Laredo Youth and Civic Aid.
Marina Medina, and I'm representing District 8, Lisa Cigarroa, and I also have Mike's Purpose Overdose Awareness and Prevention.
Hi, my name is Diana Chavez. I'm an office assistant for the AOT program.
Good afternoon, Adriana Rodriguez from the Assisted Outpatient Treatment with Laredo Public Health.
Adriana Morales, Harm Reduction Specialist with Laredo Public Health.
Erica Lopez, Program Manager with the AOT Program with Laredo Public Health.
Christina Black, the Health Education and Promotion Manager here at Laredo Public Health.
Carmen Andrade with Children, Youth with Special Healthcare Needs Supervisor. I'm Barbara, Supervisor for the Community Mental Health Program.
I'm Frank Sanchez. I'm a supervisor / Sacramento Region Coordinator at Border Region Behavioral Health Center with the Children's Department.
My name is Miguel Banquera. I'm representing Elisa Cigarroa. I'm a concerned citizen, I'm a parent, I have an LGBTQ child in Laredo, and so that's why I'm here.
Good evening, Adam Martinez. I represent District 2, and I'm also U.S. Probation Officer.
Good evening, I'm Arispe. I represent West Care, drug-free communities, Los Podemos Juntos, Driving Together. It's an initiative to prevent drugs and alcohol abuse in our community, targeting 78040 and 78046. And I'm also the board chair for Holding Institute. Please pray for us.
Yes.
I know all the immigrant situation So just for those who don't know, immigrants were being housed temporarily until they found their sponsors, and now we don't know where we're gonna be. So please pray for us. We used to get 150 per day and up to 200, and now it's 20 for the immigrants.
We'll pray.
Thank you.
Hello, my name is Sergeant Heriberto Avalos. I am a supervisor for the mental health unit. I'm also the supervisor for crimes against property, and I'm also the president for the Laredo Police Officer Association.
Well, good evening once again. Sergio Moreno, National Appeal Council. I'm the Suicide and Crisis Prevention Advocate within our union, our labor union. I also try to bring much awareness to the families of our workforce because they're usually absent such valuable information. And I appreciate the information that you shared. I'm just going to start researching right now. But thank you all for the continued invitation.
Good evening, my name is Fabiola Espinosa. I'm the case manager for the Frontera program from SCAN, and we cover mental health and HIV and Hep C education.
Hello, my name is Jesse Sanchez. We are TLF Insurance. We have a radio show, so we provide information also for these all programs to get families that information they need to reach out.
My name is Mirna Lafonte with the Lafonte Insurance. As my husband said, we love to be involved in the community, and all the time, since we deal with insurance, we all the time say to our people, no está solo, call 98. Thank you.
Hi, I'm Laura Cortez, and I'm the Director of Special Programs at Puerto Rican Behavioral Health Center.
Hi, I'm Marisela Salinas Jackman. I am a committee member representing District 4 Councilman Rick Garza. I'm also the first assistant at the Webb and Zapata County District Attorney's Office. And I'm here. I'm very pleased to be here. I'm honored to be here. I believe that I've seen our criminal justice system is handling things that should not be held by the be involved in the criminal justice system. I believe we need desperately a mental health system, especially in our area.
Thank you and welcome.
Good evening, Ricardo Gonzalez, Assistant Chief of the Police Department, and I concur with all that.
Good evening, everyone. Pleasure to be here, my first time in the county. Fred Solis, Vice President for Student Success and Enrollment at Laredo College. The way we promote 988 is we have our electronic billboards running the banner all throughout campus, both campuses actually, all day long.
Thank you so much.
Hello, my name is Adrian Esparza. I'm a District Chief for the EMS Division for the Laredo Fire Department.
Thank you for
And
being
this is my
here.
first time as well.
Welcome. Angie?
Angie Flores,
Thank you so much. And we have one of our media partners over here.
Jose with Laredo Morning Times.
Welcome, thank you for your support. And I am Julie Pasan, Executive Director of the Area Health Education Center, the best AHIC in the country. And, but you know what makes it best is because we get to work with people like all of you around the table, so thank you for that. And this is why I agreed to be here and to be part of this committee. I was appointed by our mayor as your chairperson, and it's been a privilege to work with all of you, but our work is not done or complete. And so the next item on the agenda, what are our plans for 2025 or for the future? In a nutshell, what we did in the past year, and all of you were part of it in one way or another, is promote, create awareness, walk around with banners, wear t-shirts, the buttons, do presentations, we do PSAs, we did everything that we could with zero budget, right? And I'm very proud of all of that because nobody can say that. But again, nobody does it alone. We were able to recruit the support of the La Fuente Insurance, our media partners, Laredo College, all the banks. A special sponsor donated the buttons and the banners that all of us wear and use. And so we need to continue doing something to create awareness. So I know that Ms. Jackman mentioned that we need to do something for the family members that are affected by somebody either trying to commit suicide or maybe attempting suicide, excuse me, or those that unfortunately we lost to suicide. So I'm gonna open the floor for discussion, and discussion is welcome from everyone. Based on what we have done in 2024, based on the discussion we heard today about the apps, about the intervention needs, where do we wanna go in 2025?
Have we heard any information about the letter campaign about trying to get a bill at the Texas legislature?
For?
Getting a clinic here.
Mental health facility.
For the hospital.
Annex.
Thank you for saying that. And in November, when we met, we did talk about, we sent correspondence, and I think all of you received that letter to sign it on behalf of your agency requesting that we needed some kind of presence here in the form of a mental health hospital. It didn't matter how big or how small. And I think they received quite a bit of letters from all of us in the community. For those of you that were not here at the time, I can send it out again. Angie, can we send it out again so that they can sign it? It's not too late because decisions have not been made about that. We're hoping that that will get attention during this legislative session. I know that it went to State Rep Raymond, Senator, and different other people at the legislative group. So what we can do is pray and hope that they will listen to us. And if that happens, I mean, we've already done great, right? But they also pay attention to what's happening in our community, that we're not just sitting around waiting for somebody else to take care of our needs. We are proactive people. We are people that care, that take the time to plan and carry out the activities. So again, I'm coming to you and asking you, besides that, what else can we do? What else do we need to do? Do we need to explore developing a plan to meet the needs of the people that are left behind? Mourning the loss of their loved one, or dealing with the pain of somebody having those difficulties and maybe considering suicide? What is it that we want to do?
Julie, I know Puerto Rican used to be the location for NAMI. And I don't know where they are right now, but NAMI was a...
There used to be what, I'm sorry?
NAMI.
Yeah, the
There is
National
no
Alliance
NAMI.
for.
There's no NAMI in her.
No more?
No,
What does
4
that
years
stand
ago,
for?
Yeah.
the National Alliance for Mental Illness.
Right.
And
So
they do.
That's a very...
It's a peer-centered organization where a person who has a lived experience helps another person, and it's a very good agency. I know San Antonio has it, Corpus, they have different regions, I guess, per se. And individuals, clinical individuals come in and speak to them along, it's peer-to-peer. I don't know,
Maybe starting up the NAMI again. I know
Yes.
that's something that's always brought up where when we have meetings with SAMHSA and stuff like that they're in disbelief that Laredo does not have a NAMI.
What happened to the program?
I think they just lost like their people who ran it, and therefore it just became non-existent.
I think at the end of the day, if I may say, the reason why some of these good groups kind of fall apart is because lack of funding, and everybody's overly committed, right?
Yes.
So we don't want to create another group that's going to take our energy and deposit it over there. On the contrary, why don't we reach out to them to see what they can send this committee to support its mission?
That's what I was thinking.
And we can, and Jaime, thank you for volunteering to do that.
Oh my God. Thank you.
That's an excellent point, and I want to continue to explore that. The other thing that I wanted to say is, the other item that I captured from our chief here is that when there's a student that's impacted by the loss of someone, suicide, that the schools become aware or become involved or have more resources to help the child. So definitely we need to revise our list of resources, and that can be done, within a day or two. But before we release the QR code again, we'll send it to all of you so you can look at it. and give us your input. Who else do we need to add? I know we have all the local agencies, some national numbers and apps. We need to maybe add some of the other apps that you're referring to so that people can have access to these resources, right?
Yes.
Dr. Basan, who's supporting the back-end information on that QR code? Is it the health department or
No,
not?
it's us. And we just added a couple of psychiatrists that reached out to us and they want to support it. So we'll be getting the QR code will be the same, but the information is
Right.
different.
Can you also, and please don't put me in that committee.
The counseling department?
At the St. Nurse,
We have them.
you already have them as part of your group?
Yes, yes. But yes, thank you, Jaime. If there's any other group you think of, let us know.
Okay.
Okay, so we're gonna update the resource referral page. We're going to, I would like to have a process. And Chief, what is it that y'all do when you, and Sergeant, when you go to a site? Cause y'all are part of the first responders along with the fire department, correct?
So.
What do you leave for the family? What do you tell them?
So before, the concentration was obviously on the scene, right? Processing the scene. Because at that point, it's a death investigation.
Right.
There's a lot of unknowns. So that is our main priority. But obviously, we found gaps that early in the investigation, we knew there's a loss in the family, whether it's a homicide, suicide, you name it, the loss is still there. And we found gaps as far as educating our personnel with the resources, the proper resources to support the family. And sometimes, especially when there's no follow-up, the death is a death by suicide, there's no follow-up. When it's a homicide, there's continuous engagement with the family from the investigation to the prosecution. So there's always communication with organizations that can link into services. But the big one was, and obviously when there's a homicide, the state has specialized services backed up with funding to support them. So unfortunate situation, but there's a whole bunch of support. Death by suicide, there's pretty not much. Once we know that there's no follow-up to continue, we move on to the next case. So we obviously saw the gap. This informational card that's supported by information is what we've been equipping our detectives that work with the family to be able to deploy programs such as the Handle with Care, and hopefully now with UISD, who I don't know, they don't like to mirror each other. They like to be unique, but I think it's a good program. It makes it easy for us to link people to resources, and it's immediate. That is a very efficient, inexpensive way to be able to continue that support to the family.
Okay. I noticed in some of the cases that some of these people were receiving services at Border Region. So I don't know if when that happens in a case like that, does Border Region follow up with the family or anything? I'm just trying to figure out.
I know there's a death review committee.
Yes.
That is run by QM. So, but going back to what y'all were talking about, families not having follow-up. I know Tammy Weppelman is the one that trains us suicide loss and establishing suicide loss teams. So I'll reach out to her. But with a suicide loss team, that's when Dr. Frank Campbell, who's a renowned, world-renowned suicide loss trainer from Louisiana, you have to have those people that have lived experience and a clinician to go and do what you mentioned that is not being done. Okay, so that is something that is vital in a team like that and because we had those lost survivor individuals talk about their experiences at the conference this year, how helpful it was, but when it wasn't there for them, they were at a loss or they were blaming themselves for that suicide. So that's why I know it's so traumatic for that individual that found her grandfather, or her relative. So having somebody in the suicide loss team that wants to be part of it with lived experience, but having a clinician all the time. Because it cannot be one person. And a lot of this loss teams, again, if it was a veteran, it would be a person from a veteran company that would do the cleanup. You know, they would give the services to that veteran. So those things came to light to where funding, again, was non-existent for those cases. So it has to be grassroots and people volunteering to wanting to do that.
And thank you, Frank, for bringing that to the table, because like I said earlier, we don't want to reinvent the wheel. If something's working elsewhere, let's review it, let's do the research, and then let's look at what resources do we have available to meet that need, or to replicate that program or system or whatever it is that we're looking at. And we have a zero budget, but who says that if we don't come up with a good proposal and we go to the city and we say, look, this is what we have identified, but we need money. And I'm not making any promises, or I'm not saying that it can be done, but you know, we've got to be prepared. We've got to have a plan, and that plan is gonna meet what need and how soon and how many people. So I think that this is something that we can certainly investigate further. Do you have the information on that?
I'll contact Tammy, Ms. Welcome, she's from Health and Human Services, to give me some dates. I have spoken to Assistant Chief last time about it. So we need dates so we can include all law enforcement and of course the coalition to receive that training.
And I think it would be a wise thing, since in the interim, before we get any sort of funding, we can try to absorb it in the agencies that are already doing this, and that would be LPD, the Sheriff's Department, the responders. If it's the beginning of the year, and we can say our goal is to service the people starting in 2025, any of the families. So perhaps it would be a good idea in the death report to mention in the report the people in the household, or anybody that obviously is affected, like if somebody says a tia was affected, even if she didn't live there, but it's mentioned in the report so that we can have data on these individuals, and we already have that available, so that once we do have a protocol, we can reach out to them.
Immediately.
Mm-hmm.
Dr. Basan, and I'm glad you mentioned that, because I did notice that there's pretty much the ones who were patients, but there's people that are out there, that agencies that are out there that reach out to them, but we have some that don't have any history, and there's holes there because, and I'm just going to give you an example. Of course, you all saw the news. We had a DPS trooper who committed suicide, and I was embarrassed because the family members reached out to me, and they want closure, and they wanted to see. They have questions. And I try to speak to the investigator and the supervisor, and they're like, what do they want to know? We already told them he passed away, and I was embarrassed. I'm like, I can't tell them that. The family's looking for closure, and there's nothing that we can provide ourselves as a police department for them to have that. And it's sad, but I'm glad that you all are mentioning that, because if there's something that we can train our detectives or our homicide division, it'll be great, because we can always provide them with that opportunity, with that.
And one of the things that these families often ask for is they want the medical examiner report that we can't get a grand jury, when it's not a criminal investigation, you can't get a grand jury subpoena on that, or the medical records. And so we need a roadmap on how to obtain efficiently and immediately for these family members to get closure. Something as simple as a medical report or the death certificate, these types of things provide some sort of closure. And so oftentimes one of the questions is, were there drugs? They want to know things. So those are things that we definitely can already, within our systems that exist, try to absorb that and figure out a way, include them in the protocols for very simple, basic follow-ups.
Yes.
Along those lines of follow-up and bringing closure, does LPD have the technology to do digital forensics on social media posts that maybe the individual could have
Yes,
left behind? And
We do, sir, we do,
Okay.
and normally when something like this happens, our detectives, I mean, they take all avenues, they make sure
Okay.
they dot all their i's and cross all their t's to make sure that there wasn't something else. And of course, a lot of the information that we obtain on these investigations, it's through the family.
Right.
And we sometimes we just base ourselves off of that.
Off of that.
But anything else, our detectives, that's one of the first things that they start looking at.
Okay.
Social media, loved ones, are they poor region patients, things like that. We just want to make sure that we don't leave anything unturned, no stone unturned, pretty much.
Well, in conversations that you can have with individuals like that, is that suicide is multifactorial and it's complex. There's no one reason as to why they decide to die by suicide. Okay, so we could, and the flyers that the state gives us is very important. That's what I do with my zero suicide training with new staff that comes in, is that we have to remind them that it's multifactorial. There's no one reason. And even when they've come to a conclusion that they want to die by suicide, they might be having dinner with you, and then they decide to just walk 8 steps to that bedroom and do it. So we have to, when they bring it up, don't say that they're having, it's just, you're crying out for help. You're just being childish, or, you want attention. Take him seriously. And we remind staff that if you have those individuals that are en la tercera edad, up in age, reach out to them and do communicate with them, always. Because they say, I'm gonna talk to you, I'm gonna call you, but they never do. And that's when they feel a sense of burden, especially if they're going through medical conditions. And that is one of some things that we continue to see throughout the state of Texas. Texas, if we were to reduce suicide, like I mentioned the last time, in Texas and California, we would have a great impact on the numbers for the whole United States. That's how bad it is. Okay, so it is a public health concern. So that's the reason we're doing what we're doing here. And I appreciate everybody that is here, especially those that have lived experience, because it is tough. When we're doing presentations, we have to remind individuals that presentations that we're doing is, if you have some lived experience or recent experience, you might not want to be a part of this presentation. We have to be reminded of that, because we have to be cognizant that language matters. And so that way we don't impact them, because you might trigger. So we have to be careful when we're talking about these things as well. Okay.
Thank you so much, Frank. Yes, Laura.
This also brings up a topic of mental health first aid.
Oh.
Right? And I'm an adult as well as I provide youth mental health first aid. And it's so vital that everyone knows what mental health first aid is. Everyone knows what first aid is, CPR. But when it comes to mental health, some people don't know what the signs and symptoms are. And those are free. And we
So,
offer them.
is everybody around the table trained in that? Mental health first aid? No. Okay, if you want training, and I recommend it, our staff just went through that as a team. For the youth and the adults. Please, let Laura know, because I think it's very, very important for the committee members, especially for everybody, to take part in that.
Dr. Basak?
Yes.
Can you enlighten?
I don't know the mental health.
Yes, okay. Mental health first aid is a training that's offered. If it could be virtual, which is a six-hour training, or in person, it's virtually 6 hours. If not in person, it's an 8-hour training. And it's pretty much an interactive training that's offered to individuals about to tell the telltale signs of what to look out for when someone is experiencing a mental health challenge. And a mental health challenge is, someone's giving away all of their prized possessions and writing that special note that I'm gonna terminate my life, right? I'm gonna take my life. So there are signs and symptoms, and that's what they teach you.
And also how to talk.
And there's special videos, and you also, go ahead, I'm sorry.
No, it just, and how to talk to people. as
Oh yeah,
well
how to
as
talk to
students.
people about.
Well, Laura's the instructor, so she can tell you. She'll send everybody the information on that.
Yes.
It's basically a training so that you know how to identify the symptoms or signs
Yes.
and what to do to provide that first aid.
Yes.
So if she's suicidal, it'll give me the tools to understand her and be calm and call 911. Gives you the steps to intervene.
And as a first aider, what that means once you get this training, doesn't mean that you're the specialist, but you know who to go to and who to send these individuals out to, the specialists that are there, that are trained to help this individual get the
Thank you.
services they need.
So we will send it out to all of you for the youth and the adult, because they're two different trainings. And if you want to participate, they are provided at no cost. Very, very good. And I think the certification for 2 or 3 years, right?
Yes, that's correct,
Okay.
that's correct.
So I recommend that all of us do that. So this is already something we can get done. Again, we have 0 budget, and this is something that we can all stand and say, you know, we're doing what we can to be prepared to respond to the call. I'm going to summarize what we have talked about so far, and if I leave anything out, please let me know. Number 1, the resource update on the QR code, and we will make that available to all of you right away so that you can review it before it's shared in final format. And please look at it quickly and just say yes or no, you left out this, and we will include that. Number 2, we're going to identify, Jaime volunteered to look into the NAMI, how they can support what we have going on. And Frank is gonna look at the suicide loss team, their system that they have in place by calling Dr. Campbell so that we can maybe incorporate some of the things that they're doing or the training. We'll also look at the protocol for assisting and supporting the families in getting closure with their loved ones. And that could be as simple as how do they go about acquiring certain things that they're asking for. And Marisela, thank you for volunteering to head that task. And we will help, right? But you're at that end of the spectrum, so you know what they're looking for. And if you tell us, then we can come up with a protocol that we can make available to the family members, and that can be incorporated. Yes, Sergeant, welcome aboard. The other thing that we said was, the other thing that it's probably gonna be a little bit more, it's gonna take more effort, is follow up on the families or those that are impacted, that are left behind, whether it's a suicide attempt or something that actually occurred. And that's gonna require some brainstorming. So we'll probably talk to the first responders, the fire department, police, and anybody that wants to participate in this. Just brainstorming some ideas, and we can do this virtually. For the next meeting, we can come up with at least a draft of what to help out with for those that are suicidal.
Can you, as a welcoming gift, can you include Ms. Jackman?
Yeah, I do want to be involved in that.
Yeah, I have her name on both of those too. Let me see, there was something else that I was going to say. Oh, on the apps, we're going to make sure that we share, can you send that to me, Mr. Solis and Frank, the app? Dr. Montes, I kind of took a screenshot, but if you have anything you can share with me. Is there something that I left off?
We send a letter of support so
Oh,
we can share
yes,
with others.
that's very important. The letter requesting support for a mental health hospital here in our community. That will be sent out to all of you that are present today, and I hope that you signed in. And all we want you to do is take it to your supervisor or your department head and say, can we send this from our agency? Whether they say yes or no, I would also like for you to send it as an individual, as part of this committee, as a member of this committee. The more attention that we can get on this very important topic, the better it is. So that's gonna be your homework for all of you, and please copy me on that. Yes, ma'am.
Super quick. The Black Widows, like I have been doing coffee on my own, like some of the coffee tour, because we have a coffee tour in Laredo, but I didn't get a lot of people come out like to want to talk or anything like that. So one of our members was like, we had to make like a firm date. So we were gonna like just do like female veterans, but we're opening it up to the community. It's gonna be called Chingonas con Café. And like the community can come out. We're gonna be starting at Los Olvidados. So one of our members is gonna start that, so that'll be available. And we're also doing like women healing circles. We started with 4 women and we're up to 9. Now the last thing we had was just like a painting session, and we were just like talking about random stuff. And as we're painting, you know, sometimes it was silence, but the silence was actually good. It wasn't awkward, you know, and like they're getting like a little bit of healing, you know. And I don't know how many other people out there need it, but if anybody does want it, men are also welcome to join. So that's coming up. And then Relay for Life. Any cancer survivors out there, I know it's hard to talk about it, and some of them feel like it's a weakness, like especially if you're a veteran, to ask for help. And we're trying to change that, you know, because it's a real stigma and people don't ask for help. But Relay for Life is having a survivor dinner, and everything is free. And they're also having a walk to raise money and stuff like that. That's going on. The big event's going to happen in April. So if anyone wants more information in that or wants to team up to make like the Chingonas con Café, can I say that?
Yes.
If anybody wants to team up to make this bigger,
I would like to send, can you send me that information, because maybe I will.
yeah, we're working on the flyer right now, and as soon as it's finalized, I'll post it to you guys. And for everything that we're doing, we're putting 988, You're Not Alone at the bottom.
Excellent. The other thing, thank you for that reminder of that report. Remember that we have the 988 signature logo for all of you to use in your signature and your emails. Those of you that don't have it, we'll send it out to you. And we have a new logo for our Suicide Prevention Committee. So this is something that I want to bring to the table. Do we want to continue going to the corners with the signs or not? Because that doesn't cost anything other than 30 minutes of your time. I know we did it for many Fridays. Laura joined us, the media partners joined us, Mr. Moreno, you joined us, the LISD, UISD joined us, the committee members. It doesn't cost anything other than 30 minutes out of your time. And you choose to
because I was going and I got stopped.
Really?
Yeah.
Chief.
Well, the idea was this, to do it one Friday out of the month, and it could be the first Friday, the last Friday, whatever's convenient, from 11:30 to 12 while people are going to lunch. You can choose your corner, or if you want all of us to come together and say, okay, the first Friday in February, we're going to Del Mar McPherson. The first Friday in March, we're going to Guadalupe and whatever. But I need all of y'all to say yes or no and to show up.
Yes.
Because you get the attention and the number of people that are at the corner with the signs. Believe me, you have a good time. You know what makes it worth my time? When I'm standing there and people are driving like this, and then I'm like, hi, thank you, and you get a smile. If just for that one day you make somebody smile, the 30 minutes is priceless.
Worth it. And we can try and let the news, HNS.
Oh yes, they're always there.
So that we
Our
get
media
more,
partners have been very
so it's
supportive.
multiply.
And what we're gonna do, when y'all decide what day, we're gonna go to, La Puente Insurance, they have a radio station, and I will promote that people look for us on that particular day. We'll send all the information to all of you, but I need y'all to commit. Do we wanna do this or not?
Yeah.
Yes. What Friday of the month? First Friday, second Friday, third Friday. It's gotta be something easy for people to remember, right? And then each of the committee members will rotate to make sure that you have everything you need for that particular Friday. Okay, how come everybody got quiet?
I said the first Friday.
The last Friday, we can start this Friday.
We can start this Friday?
This Friday?
I'll be there.
I mean, it's only one time.
11:30.
We'll be there.
Okay, so who's gonna start it this Friday? Because I'm gonna be out of town on Friday.
Yeah, I have an appointment on Friday.
That's okay, we have all these wonderful committee members. So you're gonna start it Friday, Mr. Moreno, where?
I'll team up with my partner here.
What time? Where?
Talk to me, Sarge.
You wanna do the intersection of Del Mar and McPherson?
That's a fun location.
Yes.
Yes.
That's,
What
Come
time?
up with signs, honk if you're happy, you know.
We
I
did
don't
that.
know. Oh, no, really? No.
We have the banners, we have
That's
the
great.
banners that y'all can borrow, you
But
can
if
come
we-
and pick them up.
If we do it in the morning so we can park at Bank of America, or do we do it at lunch and then we park a little
You
farther?
can't park at Bank of America, you can park anywhere else but Bank of America.
At the Walgreens.
and
Park
Chipotle.
at Cosmos and then go help them.
So, I'm sorry, you didn't mention the time. 11:30?
I'm open.
11:30?
11:30 to
That works.
11:30?
12:30.
I don't know, I'm just asking.
That's
Okay, 11:30 this Friday at the corner of Del Mar and McPherson. Mark your calendars, and you don't have to be there for the 30 minutes. Like, let's say I only have 10 minutes to go and spare, I'm gonna go and be there 10 minutes. Dr. Taylor has stopped there on his way to go to a meeting. But please, let us, if we commit to something, let's do it. We still have some T-shirts at the AHEC office, we have some buttons, so whatever you need, come by, and we're here to support one another. Any questions? I think everybody has homework, and I wanna thank all of the committee members for being here, 100% attendance. Oh, the other thing that I forgot, for those of you that did not make the training the other night, it is available on the YouTube channel for the city, correct?
Correct.
So please, I missed the last portion of it, so I have to go back and review, but if you were not able to join us, it's available on YouTube. Check it out, it's really valuable information, and I am very happy to say that this committee is in compliance with everything they talked about. And so congratulations for that. We get an A. Okay, any other business or discussions?
We make a motion to adjourn?
Okay, I have a motion to adjourn, a second? Thank you. All those in favor say aye.
Aye.
Meeting adjourned. Thank you so much. Be safe going home.